Hey YouTube, welcome to another edition of the Nurse Lounge. This edition, we're going to talk about 10 tips for nursing school success. If you're interested, stay tuned. All right, you're going to see me look down from time to time because I have my notes written down, so don't mind that. But we're going to go ahead and get started with tip number 1 is commitment. You have to want to die for this program. Not literally, but you have to want this program so much, nursing school, so much that you are willing to take almost any sacrifice you have to take in order to succeed. So you have to be committed to it. Tip number 2, you need to read ahead. You don't know how many students that I encounter that they go to class expecting the professor or instructor to provide the knowledge. No, if they tell you to read chapter 1 through 5 prior to class, you need to read chapters 1 through 5 prior to class. The whole point is for you to have some foundation knowledge so when you come to class, you can just take notes and the instructor is supposed to provide you extra information to add on or supplement what you read from the book. They should be able to provide examples or real life stories that they may have about what happened when a certain disease process they saw in their work experience. So read ahead. Do not go into class thinking that you don't have to read the chapter, but you can get everything you need to get from the lecture material. Number 3, ask questions and be self-directed. So you have a responsibility to learn as well as the instructor has a responsibility to teach. If you're not understanding something, take the time to ask the question. With that being said, I find students typically want to ask the instructor everything. You have to have the ability to be self-directed. What that basically means is you need to take the initiative to look things up on your own. So often students ask me something like, what does SVD mean? And I'll say, go look it up. Why do I say that? Because anytime you take the time to go look something up on your own or be self-directed, you will remember it. If you have to ask someone, you will remember it for the time that you need to know it, but then you'll dump it. Your brain naturally will get rid of it because you didn't really need to process it for any reason other to do what you needed to do at the moment. But when you take the time to look it up, so you've looked on the online, you've looked in your books, you have looked at your notes, you've asked some of your peers. By the time you go through all the process of doing that, you will retain it. You will remember it. And don't be afraid to write it down either. You need to write things down. So that's just an extra tidbit. That's not actually a tip, but that's a tidbit that goes with that. So number 4, develop critical thinking skills. What does that mean? Sometimes people think that nurses, all we have to do is just do what the doctor says to do. That's far from the truth. We do have to follow their orders. However, we have to be able to make critical thinking judgments based on what our patient presents with. So if our patient presents with a certain disease process, such as hypertension, and the doctor says to administer 1,000 milligrams of labetalol, but their blood pressure is 70/40, critical thinking skills would tell you based on your assessment that we're going to have to hold that medication. We're not going to just give this medication because the doctor's orders says to do so. In doing so, you could kill that person. So our critical thinking skills are of paramount importance when it comes to taking care of your patients. Number 5 is don't just study for the tests, but learn the material. I find students oftentimes saying, oh, that wasn't in the chapter that we read, or they said to only look at this table, but they had other stuff in the test that was from other parts of the chapter. Well, first of all, sis, you're responsible for the whole chapter. So if they tell you to read chapters 1 through 5 for a test, You're responsible for chapters 1 through 5, even if they didn't discuss it in class because they've already assigned it to you. Number 2 on that issue is you are not learning just to learn what you have to regurgitate for a test. What we do in nursing is far from what you take in your test. Our jobs are on-the-job training, literally. So we are taking our foundation from nursing school and we're building off of that based on what our patients present with in our nursing world. So again, you're not learning it just to take a test. You're learning it to save a life. You're learning it to make someone's outcomes better. You're not learning it to say, okay, well, this test said we had to do this when it comes to diabetes. We have to do this. Well, that's true for this patient population. Think about this when it comes to diabetes. I tell my students all the time, diabetes is a disease process, but under diabetes, we have an umbrella of terms such as hypoglycemia, hyperglycemia, and say gestational diabetes. Those all fall under the realm of diabetes. However, how we treat those three are vastly different. So how I treat someone with hypo or low blood sugar versus how I treat someone with hyper or high blood sugar is going to vary greatly from how I treat someone who has gestational diabetes, meaning that she is pregnant and has diabetes during the pregnancy. So again, I hope you understand that concept that we have to learn what's going on with the disease process and how to apply that to the real world, not just learning to take a test. All right, number 6. Time management is of the essence. In nursing school, you typically have 1, maybe 2 patients in nursing school. Well, guess what? In the real world, you can have 5, 6. You can have 15 if you're LPN and you're working in a LTC, long-term care facility. You can have many more patients and disease processes than you have in nursing school. So time management is of essence. I tell students, when we have 1 patient, act like you have 6 and you will get your work done instead of acting like you have 1 or 2. My students tend to be the ones who, oh, I'll get to that. They're doing this right now. Oh, they're sleeping, so I'm going to do my assessment later. No, that's not how that works. When you have 6 patients to juggle when it comes to their disease processes, their assessments, vitals, their charting, their care in general, you have to have time management skills. And in addition to that, prioritization skills. So who do I see first? Which one do I do first? You have to know how to do that. And the only way to get good at that is to challenge yourself and get better and pace your time. Don't be lackadaisical in your approach in terms of like, oh, I'll get to it, I'll get to it, I'll get to it. Time is of the essence. All right, number 7, NCLEX prep. Begin your NCLEX preparations, not your senior year, but as soon as you start nursing school. So you need to go ahead and get in the process of learning how to answer NCLEX style questions. Your instructor should also be giving you questions on the test that kind of resemble or mimic those kind of questions so that you will know how to be prepared and answer those questions in an appropriate manner. Number 8, you want to prioritize. I mentioned this earlier, but you want to prioritize in the sense of what do I need to do first? Not necessarily on a test, but what do I need to do first in terms of my approach to studying, my approach to clinicals, my approach to networking when it comes with other students. What do I need to do first? So in nursing school, you have typically 2 to 3 classes that you take at a time. Do not, take the time and say, okay, I'm going to worry about a paper that's due at the end of the semester, and then you have something to do that's due next week. Which one is most important right now? Do the paper that's due next week. And again, don't procrastinate. So don't wait till the day before. That's something that we tend to do as nursing students is procrastinate, but you will learn very quickly when you come back with that F that you cannot do that and be successful in nursing school. Number 9, be organized. So when it comes to being organized, you want to make sure that you have everything that you need in terms of paper, pens, pencils, your textbooks. That's the big one. I don't know why students do not buy their textbooks thinking that they can be successful in a class without having your textbooks. So be organized means you need to have your textbooks, your paper, your pencil. You need to be ready. Even when it comes to clinicals, having your clothes, your uniforms already ironed and your badge in place. Having your badge in your car. I've had students that I've had to send home because they didn't have their badge and they were not allowed to return. You cannot be in a facility without your badge, at least at the schools that I teach at. You cannot be in a facility without your nursing school badge. So be mindful of that. Iron your clothes. Make sure you have the right shoes on. Make sure you have the right undergarments on, the right socks on. If you have to wear a nursing hat, make sure you have your hat. Make sure you have your stethoscope, your nursing bag with you. Everything, have it ready. Be organized. And last but not least, number 10, and that is form study groups. You need to find peers of yours in nursing school that has a similar study pattern as you, that has a similar work ethic as you, who have the same goals that you have. In form study groups, you learn so much better together than you do apart. So sometimes I remember when I was in school, I had study groups and we would study together all the time. But because I had children, they would always come to my house so I didn't have to take my children out to study. And that helped me so much because I needed to have my kids at home in bed by a certain hour. And we would be at my house studying at the kitchen table till like 9, 10 o'clock at night for test. Study groups will have you, for one, connected with your other nursing students. You will build lifelong friendships with nurses by doing this. And then also that feeling of not being alone when you don't understand something. Sometimes instructors or professors can be a bit intimidating. So having some peers who can explain things to you in a better way can help you understand and you could be successful. All right, so those were the 10 tips of nursing school success. Again, they're not all inclusive, so there are more tips out there. If you happen to have some because you're already a nurse and you can think of some that I didn't mention, please list them below so that we can have a dialogue about that and enlighten and help other new nurses with their journey of becoming a new nurse or nursing. With that being said, thank you so much for watching. Don't forget, as always, to subscribe. Hit that notification bell so you'll know when I upload. And until the next time, take care.